Hello, dear aquarists. Today I will show you a video on Aplocheilus lineatus, a killifish that has been suffering in the aquarium, become skinny, waste away, and we used a microscope and we could find skin flukes and gill flukes. So let me share you my PowerPoint so that I can explain you more in detail what we found and what you can do about treating flukes. So Aplocheilus lineatus had skin and gill flukes and a bacterial infection, and that is killing the fish. My books on fish diseases give you more info available in different languages on prevention, good diagnosis, and how to apply medications to treat fish diseases. And here we see some of the aplocheilus, like this one here, the one in the back, which are separating from the group. They become skinny, they don't come to eat anymore, and they waste away. And that's the fish you take out for examination, and we took a skin scraping, and then you can see these little animals, those little worms, skin flukes attached to the scales, and of course causing damage and causing lesions to the fish. Make the fish suffer, make the fish become weak. And here we see a part of the pectoral fin. Sometimes interesting to check the pectoral fin of a fish. And look how many flukes we find here. And then on a specific spot of that pectoral fin, there are many of them grouped together. Look here, a massive amount of skin flukes on a specific location. And that is sometimes important to check on that part of the body of the fish for flukes. I found the same problem in guppies. Hardly any flukes on the scales, but quite a lot on the pectoral fin. Why? I presume they have a better chance to survive the treatment or to have a better life, a better attachment, a better grouping, because skin flukes are life bearers. So that babies are born directly from the parent fish, a parent fluke, so they can become very quickly a group of worms that can cause lesions. And here we see it on the pectoral fin. At the same time, we found also gill flukes. And you could see already some damaged parts of the gills. Then that is bacterial infection coming. And here we see also one gill fluke. There's a nice microscopic observation I want to share with you. But you can see this gill arch is gone. And also this, no filaments here anymore. And that's bad. Here we see parts of the gills that are very bad and of course causing the risk of the fish to die. At the same time, there was a bacterial infection inside with a bad liver on the left and here on the right, a bad spleen. Of course, the bacteria penetrate through the gills because of the damage of the flukes, and then the bacteria can come inside also in the organs of the fish. Immunity system goes down, fish weakens, fish doesn't eat anymore, and of course they're gonna die. But the flukes are a serious damage causer, but the bacterial infection is killing the fish. You have to apply an anti-fluke medication combined with an antibacterial medication. Don't wait, you will lose time. Suggestions in my books are listed what kind of medications you can combine and use, or ask your pet shop, your fish doctor or veterinarian. There are many products available to control flukes and bacterial infections, and my books give quite a list depending on what you can get, where you can obtain it, and what kind of contacts you have with a veterinarian or with a fish doctor. At the same time, functional fish food can help the fish to fight off the infection and to restore immunity. And I would recommend our Dr. Bassleer Buy Fish Food Garlic. Read my books. They are available below in the link I provided where you can purchase them in the language maybe you want. Maybe you want more specific training on fish diseases. Yes, I have different courses available at my Patreon channel. So I hope this video on this killifish, Aplocheilus with flukes, help you to understand how important a microscopic observation is. Thank you for watching.